I am Cesar Rodriguez, and I am an associate professor at Mount Sinai, and I am the clinical director of the myeloma program. Myeloma is a type of blood cancer, and even though it's not a very common cancer, it is the second most common blood cancers that tends to affect humans. And it is a cancer that comes from a type of blood cell called plasma cell, which is in charge of our immune system. And the way this type of cancer tends to affect our body is that it can cause bone lesions, bone fractures, kidney damage, anemia, frequent infections, and high calcium. And this is one of those cancers that tends to affect people in their later ages of life, normally in the 60s and 70s, tends to affect men more than women. It tends to affect the Black community more than other races. And it is important to identify at an early stage so that we can treat it and prevent the damage to these organs. Multiple myeloma is treated by a combination of therapies. We can treat it with radiation to treat a focalized area, but this is a type of blood cancer that tends to be in all over the body because it's in the blood. So we normally treat it with chemotherapy. But before you start getting worried about the typical chemotherapy that we think of, where people lose their hair, are in the hospital, sick as a dog in bed, that's not the case with myeloma necessarily. There's been a lot of new drugs that have come out in the last years. We now have up to 18 drugs that we can use, and we tend to mix and match and combine therapies so that we can have a better control of disease and put the disease into a remission. So you use a stem cell transplant using your own stem cells that are in charge of making healthy blood. And we have also clinical trials that Mount Sinai has been participating in for many years and have that to offer to patients when they're diagnosed with myeloma. Yes, so one of the nice things about our myeloma clinic is that we are a center of excellence, and we have criteria of what services we should be providing myeloma patients, how we should be treating patients. And we have really made an effort that if you are somebody who wants to be evaluated at the myeloma clinic, it doesn't matter if you go to the Brooklyn clinic or to the Chelsea clinic or the main campus, you'll be getting the same care, the same quality of doctors, and access to the same clinical trials in all three areas. We are committed to going to you and helping treat your myeloma closer to home rather than you having to drive all the way to one specific site for the care that you require. Yes, Mount Sinai is very well known to do research in multiple myeloma. We have different types of research. We have what's called clinical trials, where there's therapies that we are offering to patients, novel therapies that would not normally be available for patients because they're still not FDA approved. But this is the way we discover new drugs. And the government tends to evaluate these clinical trials, make sure that they are safe to give for patients. And nowadays, some example clinical trials that we have are immunotherapy, bispecific T-cell engagers, trispecific T-cell engagers, CAR T therapy, and therapy that's trying to use the immune system to destroy the cancer rather than use conventional chemotherapy. In addition to that, we also have basic science research. So we are also having some doctors and scientists at Mount Sinai look at the myeloma cells, try to understand how it works, and try to see if there's any new therapies that we could use to treat myeloma and understand the mechanism of how myeloma behaves in our body so that we can future therapies and have a better control of the disease. I do strongly believe that Mount Sinai is the best institution for multiple myeloma care in the region and possibly nationally. We are the largest myeloma center here in New York and in the region. We have 9 myeloma specialists. And I do think that all of the myeloma doctors that are part of Mount Sinai and are going to all 3 myeloma clinics have top-notch qualities. And the beauty about our care is that even if you're seen by one particular doctor, cases are discussed among all the doctors so that we can all give our opinion and make sure that we are giving the same care to everybody. So if one of us is missing something, the other person can chime in, and that way we can try to improve the care for our myeloma patients. Another reason why Mount Sinai is an excellent place for myeloma care is we have a multidisciplinary approach. We have access to excellent kidney specialists, to heart specialists, to orthopedic doctors, to neurologists, to spine specialists, radiation oncologists. We have physical therapists and nutritionists, as well as social workers that all work as a team to try to help patients with multiple myeloma, not just to treat the cancer, but any complication related to that cancer. And then the great access that we have to clinical trials.